members of the Presidential Steering Committee, distinguished ladies and gentlemen, gentlemen of the press, let me start by truly apologizing for inability to start this press briefing at the appointed time. Our sincere apologies. There was so much on our table to cover. And coming out of a very busy weekend for most of our ministers, it became obvious that we were not going to be able to get here in good time. However, I welcome you to the national briefing by the Presidential Steering Committee on COVID-19 for today, Monday, the 27th September 2021. Let me begin this first briefing by introducing to Nigerians Dr. Efeda Molayo Adetifa, the newly appointed Director General of the Nigerian Center for Disease Control. From 1st of November 2021, he is currently understudying the incumbent and learning the ropes on the national response. Global cases have been on the decline for some time now, but there is need for more caution, especially among Nigerians. The Presidential Steering Committee has observed that caution is needed rather than overconfidence, and that there is a decline of suspicious index among doctors. To slide into complacency can be very fatal, hence the need for serious caution and adherence to the non-pharmaceutical intervention measures, vaccination, and protocols of self-isolation. The coronavirus is still very much around us, and it is virulent and deadly. The Presidential Steering Committee has taken note of the challenges raised by travelers that visit the national travel portal, in compliance with travel protocols. It has similarly noted with dismay fraudulent activities perpetuated at our international airports by on-duty staff who extort money out of those who equally wish to evade quarantine requirement. The authorities are conducting necessary investigation into various reports received thus far. Notable progress is still being made in the area of vaccine. Over 3.5 million doses of Pfizer is being expected from the United States government this month, while about 4 million doses of AstraZeneca is being expected early next month. Nigeria will be receiving over 1 million doses of Johnson & Johnson shipment on a monthly basis. The Presidential Steering Committee is committed to access enough vaccines for the 70% eligible persons in the country in record time. The South-South Geopolitical Zone Town Hall meeting held on Saturday, the 25th September 2021 in Benin City to discuss the ongoing COVID-19 vaccination program in the country and get the view and commitment of the leaders and people in our efforts to protect Nigerians against the pandemic. We encourage the people to come out and take the vaccine, as well as take the responsibility to mobilize our families and communities to get vaccinated and continue to observe the non-pharmaceutical interventions to prevent further spread of the virus. Remember, no one is safe until everyone is safe. On the United Kingdom advisory on COVID-19 vaccines and changes to the international travel rules, the British High Commissioner to Nigeria has stated that the UK government, of course, supports the vaccination program in the country with vaccines irrespective of where they were manufactured. They will, however, open up international travels using a standardized COVID-19 vaccination certificate process to allow for ease of travels from countries, Nigeria inclusive. This may be the last press briefing by Dr. Chikwe that he will be attending. So I want to use this opportunity to thank him for his diligence, professionalism, and commitment to duty and the nation. We recall with nostalgia efforts spearheaded by Dr. Chikwe during the most difficult period of our country of Ebola and coronavirus, when he had to deploy surge teams to support the states, move materials to the subnationals. We also recall with fondness the increase in the number of PCR laboratories, as when we started we had only 2 to over 100 in a record time. These are monumental achievements, along with so many other things that he has done in the course of this national response. And that has written his name in gold. The Presidential Steering Committee urges him to continue to be a good ambassador for our country at the World Health Organization. Before I invite the Honorable Minister and those of them that will brief you for today, I now have the singular honor and pleasure to ask Dr. Adetifa to stand out so that you can identify him and also recognize him. That's our new DG for the Nigerian Center for Disease Control. Thank you. You're welcome. I now have the pleasure to invite the Honorable Minister of Health, followed by the DG, Nigerian Center for Disease Control, our outgoing Dr. Chikwe, and the ED, National Primary Healthcare Development Agency, and the head of the Technical Secretariat to quickly provide you with some technical updates. And thereafter, if time permits, we will take your questions. Once again, our sincere apologies for starting this briefing rather very late. Thank you, and have a very pleasant evening.
Good evening, everybody. And I also join the SGF in apologizing for the belated start of today. The Secretary to the Government of the Federation, the DG, NCDC, and NPCDA, permanent secretaries, representative of the World Health Organization, the incoming DG, NCDC, he has just been introduced, and National Manager, Dr. Mukhtar Mohammed, and all other members of PSC. The figures for the COVID-19 pandemic in Nigeria have changed slightly. Total number of samples tested being nearly over 3 million by now. Confirmed cases over 200, well over 200,000, 204,000 here. Active cases 9,150, discharged 192,000. Case fatality rate has remained at 1.3%, and number of fatalities 2,678, constantly being updated. Bed occupancy in the week under review was just 9%, meaning that there is not very wide utilization. in the isolation wards and of the 80 facilities that are open and operational. The total number of active cases is 9,150, and the majority of the patients on admission in isolation wards are those who have comorbidities. We recorded, as at 26th of September, 255 new cases reported from 6 states, and I think for the first time Lagos was overtaken by another state, Imo this time. Oxygen availability in the isolation wards is good. It is delivered through cylinders, oxygen concentrators, functional plants, and there is no surge in demand for oxygen. Processes for nationwide surge preparation, the training of healthcare workers, review of integrated supportive supervision, and other appropriate data collation, analysis of reports, and implementation of recommended feedbacks are all ongoing. Now, it is important for us to once again continue the process of driving critical citizen engagement in the fight against COVID-19, especially now the ongoing vaccination effort. The dreaded COVID-19 pandemic is still active, and at intervals we hear of persons lost to the illness, including some prominent names in our community. We should be a wake-up call for us to rise up as a collective responsibility to protect ourselves and the lives and livelihoods of citizens against it and mitigate its destructive impact on families and on the national economy. Since Nigeria recorded the first case of COVID-19 on 27th of February 2020, the measures that government has put in place, the non-pharmaceutical interventions and public health measures, remain valid. Therefore, most of what I'm going to be saying now will be a reminder to the public that the most reliable tool we have to protect ourselves remains the compliance with now well-established public health measures, and secondly, the delivery of vaccines to citizens. We now know for sure that a high COVID-19 vaccination coverage is urgently needed to prevent persons who may be asymptomatic but infected from infecting others unknowingly who may be vulnerable or have not been vaccinated. The government has been advised to reduce the risk to citizens by requiring a total vaccination of 70% of our population. 70%, please, of our eligible population. That is still valid, has not changed. Workers and members of the public, especially those in closed settings like hostels, hospitals, offices, camps like NYSC camps, are particularly exposed and must be a priority for vaccination, especially in view of this very easily transmissible Delta variant and growing evidence, as I mentioned just now, that persons who are not vaccinated are at higher risk of death from COVID-19 infection than those who have been vaccinated. Therefore, taking this vaccine is not only just for your own self-protection, but it's a civic duty to curtail the spread of the virus. I want to, on behalf of the federal government, express appreciation to all those countries who have been generously contributing to our vaccine stock and helping us to fight the COVID-19 pandemic. And these include the US government, the UK government, the government of Canada, the government of India, and also the government of Germany. We on our side are quickly making the best use of all these vaccines that have been donated and scaling up the utilization. Because with such availability of phase of vaccination is well underway in 36 states and the FCT. And again, I want to, as a reminder, urge those who have taken their first dose of AstraZeneca vaccine to get the second dose from the nearest designated health facility. Do not forget to always take your card with you. Persons who have not yet taken any should do so at the earliest opportunity. Again, observations, to emphasize what I said before, observations from other countries is that over 90% of their COVID-19 fatalities nowadays are in persons who did not take any COVID-19 vaccine at all, and therefore they had no protection. Whereas the vaccinated can be COVID infected, but they are not as likely to fall ill, although they may be able to infect others. And they could, in fact, infect close, non-vaccinated friends and relatives who can get very ill and perhaps even possibly lose their lives. We understand that there is fatigue in wearing masks, observing social distancing, etc., in various countries of the world, including Nigeria. But we have barely 5% of the vaccination done so far, and we need to endure in this fight. We need to endure even more than countries who have already done 50% or more of vaccination among their citizens. We are not in a position that is as strong as theirs. So I appeal to everyone to support by endorsing and encouraging the vaccination all over the country. All the procured or donated vaccines are approved by WHO. They are tested by NAFDAC and other regulators and certified as efficacious and safe. NPHCDA has begun expanding its network and also its services by training private sector providers. That means company clinics, private clinics, and in fact government centers who have clinics to be added to those providing this vaccination. The executive director will expound on that later on. The Ministry of Health is working with partners, stakeholders, to continue to ensure access to high-quality vaccines procured from COVAX facility, backed by WHO and Gavi, and also from the AVAT African Vaccine Alliance facility, where we get assured, certified vaccines. We appeal to all who wish to support government to do so. We have an account at the Afrexim Bank in Cairo, which is available for corporate organizations who want to support in procurement of assured vaccines. NPHCDA and the Ministry of Health can provide details for that. Nigeria is expecting already about 40 million doses in total from the of Johnson & Johnson from the AVAT facility, which are coming in phase by phase. So again, let me end up by saying that we must continue to observe the COVID-19 prevention and control protocols and to educate our communities to imbibe regular hand washing and other measures until Nigeria achieves a higher percentage of vaccinations. Thank you for your attention.
Thank you very much, the Honourable Minister of Health, for this. Please, may we, as our man who has worked with us, the DG SPC, is on his way out. So we will put our honor and respect to him. And we will finally be there with us. During the period of that he was with us, we don't have to visit us, we encourage us. Thank you very much, sir.
Thank you, please, Mercy. Thank you very much. Secretary to the Government of the Federation, Honorable Minister, Permanent Secretaries, colleagues, ED, WR, gentlemen of the press. Thank you. I'll keep my briefing very short. Countries around the world continuing to come to terms with the new normal. Unfortunately, that's where we found ourselves. We're learning to normalize the wearing of face masks, to provide proof of vaccination where we work, vaccinating ever younger children facing the challenges that we find ourselves in. One of the biggest achievements in the world is that over 6 billion vaccine doses have been administered. And even though we had a late start in Nigeria, we're making good progress every day. I'd like to really encourage all of us, everyone watching this and everyone at home, wherever you are, our vaccines are safe and effective, and we should all make sure we access them. Every staff of NCDC has been fully vaccinated, and every staff of every organization needs to be vaccinated in order to protect not only yourselves, but your colleagues and your loved ones. Keep yourself informed with credible information from our government websites, from the NCDC website, from the website of the National Primary Healthcare Development Agency, the Ministry of Health, the World Health Organization. Friends, we're faced with a different world than what we used to know pre-pandemic. But one thing is for sure, the science that has driven this response in Nigeria will continue to drive the knowledge that we seek in order to improve our response. Colleagues, other sister agencies, our partners continue to work very hard every single day on all the pillars of the response to ensure that we come out of this. For 19 months, the National EOC has been activated. Colleagues continue to work every day to assess the epidemiology of the outbreak of COVID-19, to follow up with non-testing sites, strategizing every day on new ways to improve the response. In addition to the new labs, we've rolled out new antigen-based rapid diagnostic test kits, sustained programs such as NYSC, enabled states to continue functioning, enabled the aviation industry to restart, enabled the economy of our country to continue to grow. We continue to extend all these efforts to scale genomic sequencing. In September, we did more sequences than any month prior, showing that we can continue developing our response every week. The logistics pillar has continued to distribute medical commodities and reagents across the country, ensuring that every hospital in the country, every federal teaching hospital has the supplies that they need to sustain the response. So today I particularly celebrate all the staff, colleagues, partners in all the federal government agencies, NCDC, MPACD, NAFDAC, NIMA, NIPRID, and our mother ministry, the Federal Ministry of Health, who have worked over the last 19 months to sustain the response. Finally, as the COVID pandemic has shown, this virus is something we will have to learn to live with for now, until science enables us to develop better tools. We will have hard decisions to make in the next few weeks and months as we define a new approach to the pandemic, putting into practice the lessons that we've learned, making hard decisions on how to proceed. Really encourage every Nigerian to do your own bit, to take responsibility, to prevent infections at home and at work, while we continue to lead the response and ensure the continued safety of Nigerians, our neighbors, and the world. Finally, to the chair of the Presidential Steering Committee, honorable ministers, my colleagues, and particularly you, gentlemen of the press, thank you very much for the opportunity of working with you over the past close to 2 years. It's been the privilege of my lifetime, and I look forward to a stronger country, as always. Thank you very much.
The Chairman of the Presidential Steering Committee and Secretary to the Government of the Federation, the Honorable Minister of Health, Permanent Secretary, DGs here present, representative of WR, members of the media, distinguished ladies and gentlemen, good evening. Let me begin by thanking you for your tremendous support on the successful conduct of the South-South Zonal Town Hall meeting, which held in Benin, the Edo State capital. I would like to quickly inform you that the Southeast Zonal Town Hall meeting has been scheduled to hold in Owerri, the Imo State capital, on the 8th of October 2021. Please, let this serve as an invitation to all of those who were part of the Benin program. We have also made provision for virtual access for those who are not able to make it. These town hall meetings, just like the chairman reiterated, enables us to further empower the people with the correct information that they require to make informed decisions about getting vaccinated against COVID-19. Our data as of yesterday, the 26th of September, shows that 4,734,769 eligible people in Nigeria have received their first dose of the COVID-19 vaccine. This comprises 3,040,000 with the first dose of AstraZeneca and 1,694,769 with the first dose of Moderna. This represents 4.2% of our targeted 111,776,503 eligible Nigerians who are targeted to receive the full dose of the vaccines in order for us to reach herd immunity. Out of the total vaccinated, 1,892,092 eligible persons have received their second dose, which means that 1,825,739 have been fully vaccinated with the AstraZeneca vaccine, while 66,353 have been fully vaccinated with the Moderna vaccine. On September 25th, 2021, the British High Commission in Abuja released a press statement which clearly stated that the vaccines administered in Nigeria are recognized and approved by the regulatory body. They also clarified that come October 4th, 2021, they will be simplifying their classification process to red list and the rest of the world. Nigeria will be moving from the amber to the rest of the world category. This indicates that the ongoing vaccination exercise in Nigeria is recognized. Please, let's not allow misinformation and disinformation prevent us from taking the decision to protect ourselves, our families, our loved ones from taking the vaccines. For those of us who have been vaccinated, it is our responsibility to ensure that our loved ones, friends, and community members are also protected from this virus by encouraging them to get vaccinated. While we appreciate the increasing support of our stakeholders and partners, it is important to point out that a lot more work needs to be done for our country to reach its target goal of vaccinating at least 70% of the eligible population, not only in terms of provision of vaccines, but more importantly, in terms of mobilizing our friends, families, and communities to get vaccinated. At this stage, I do not think that anyone should be left with any doubt as to whether vaccination is the best way out of the COVID-19 pandemic. In Europe, America, Asia, and Oceania, it is through this vaccination that COVID-19 is being controlled, and the vaccines that are being used all over the world are the same as what we're using in Nigeria.
Nigeria cannot afford to be left behind. We must understand the urgency of the need to control COVID-19 if we really want to fully recover from these social and negative economic impacts. As earlier conveyed during the first phase of the COVID-19 vaccination rollout, we plan to gradually involve the private sector as sites for COVID-19 vaccination. We have started engaging with the private sector, training the health workers, engaging with corporate organizations as well, so that we can now liberalize and decentralize vaccination. We will be doing this systematically and in phases while ensuring vaccine supply and utilization are carefully supervised and monitored to mitigate against sharp practices. Expanding to the private sector will help to further increase access to COVID-19 vaccines. On the issue of vaccine racketeering, let me reiterate my earlier warning to unscrupulous elements in our society attempting to fraudulently acquire COVID-19 cards without getting the jab. Buying and selling of COVID-19 vaccines and cards is a criminal offense. The federal government of Nigeria has provided these vaccines free of charge to all eligible persons. The officer in charge of every designated health facility will be held accountable for every vaccination card and QR code. These must match the quantities of vaccines and devices provided. Any discrepancies will attract sanctions. Supervisors and the newly established Joint Task Force will be examining the records of health facilities to ensure consistency in inventories. States will be supported to strengthen their monitoring mechanisms as well as ensure supervision takes place regularly. I therefore urge all Nigerians to report anyone who tries to buy or sell the vaccination card through any of the following: our COVID-19 hotline, 0700-220-1122, or go to the NPHCDA websites, www.nphcda.gov.ng/complaints, or the nearest police station or law enforcement agency. Our corporate vaccination is still active and available for all organizations, including media organizations. We therefore look forward to inviting us to vaccinate staff within your premises. Finally, let us continue to observe all non-pharmaceutical prevention measures as we work towards achieving herd immunity. Thank you very much. Stay safe. God bless you.
Mr. Chairman and Secretary to the Government of the Federation, Honorable Minister of Health, members of the PSC, ladies and gentlemen of the press. First, let me thank you. We can't thank you enough for all the work you've been doing in terms of keeping the COVID-19 agenda at the forefront of your news and also your interactions with the public, as well as the sensitization that you continue to provide regarding our containment measures, as well as taking up of the vaccination that is currently going on. I sincerely thank you for that effort. Every day I interact with a good number of you, asking questions either for clarity, for clarification, or asking for new information regarding our implementation activities. So thank you very much for all the efforts that you've been doing. You've been quite consistent, and you've really been an important pillar in terms of the response that we've been providing in the country. I would today want to talk about our efforts in terms of prevention and compliance to the protocol. Despite the vaccination efforts that are going on in the country, it's important that we continue to adhere to the non-pharmaceutical interventions. our vaccination level has been very low, and therefore the infection will continue to be transmitted if we do not take the right measures. The public must ensure that they prevent themselves as well as their families and loved ones from getting COVID-19 infection. And the most sure way to do it is to ensure that you remain masked even if you are vaccinated, is to ensure that when you go into public places, you maintain social distancing, and also regularly maintaining washing of your hands and sanitizing. We know it is going to take us some time before we reach the level of vaccination that will completely cut off the transmission in our society. Therefore, it is important that we take this measure seriously, and we also ensure that there is some level of enforcement in this direction. It is for this reason that the Presidential Steering Committee has sent off delegation to at least 6 states to work with the state government to develop an enabling framework for enforcement of COVID-19 restrictions. The teams are going to work for the next 2 weeks in the states of Lagos, Akwa Ibom, Oyo State, Kano, and FCT to ensure that they work with the state government and develop this framework for implementation. For the benefit of doubt, our COVID protocol still remains in operation. Curfew from 12 midnight to 5 a.m. is still operational, particularly in high priority states, and this needs to be enforced. People must use face masks when they attend public places or places of worship. This is also going to be enforced to some extent. Certain categories of public places are closed. We know that they are open in some states, but they need to be closed, and this is what our team is going to work with these state governments to ensure that we maintain the level of the epidemic at its lowest. Our efforts in terms of restriction have shown that compliance to these measures is actually very low. However, our efforts at compliance in points of entry has been shown to be quite appreciable. Since the anticipation of the third wave, we have strengthened our surveillance system in the airports, seaports, as well as land borders. We have identified certain countries that are very high risk and provided some level of restriction for passengers arriving from these countries. We have included the provision of quarantine for passengers who arrive from these restricted countries, and people who evade these protocols have been penalized by publishing their names as well as by suspending their passports for 1 year. Let me assure you that so far we have published the list of over 2,000 people who evaded protocol, who evaded quarantine in our health facilities. And that we have gone ahead to also ensure that their passports are suspended. So for every action, certainly there are consequences, for these acts of misdemeanor. We are aware of sharp practices at the airports and also at the quarantine facilities. We have investigated a large number of these infractions, and appropriate actions have been taken to ensure that people who are culprits were actually brought to book. I have received many questions from you regarding compliance to our quarantine facilities, whether people actually stay in these quarantine facilities. From the month of May, when we commenced this restriction, we have seen a progressive decline. In Lagos State, we have seen the number reduce from about 27% in May to about 16% in August, although there are areas where these percentages have increased. But for FCT, the compliance has been consistent. The percentage of passengers who evaded quarantine in the month of May was 37% in the FCT. In the month of June, it was 9%. In the month of July, it's 8%, and in the month of August, it's about 4%. Last week, because of these questions and concerns that have been raised by Nigerians, we undertook a quick assessment of some of the quarantine facilities in the FCT. And I'm glad to report to you that 99% of the passengers who have been booked in these quarantine facilities have actually stayed. That is in the last 1 week. So that is really an improvement from what we have seen earlier on. I want to thank or appreciate our international passengers, particularly the diplomatic community, for their compliance to our COVID protocol. Nigeria is not the only country that has protocol, for people who arrive from various destinations. What we see now the UK is doing is actually where we have been for the last 3 or 4 months. The diplomatic community has been quite understanding in complying with this protocol because they understand that these protocols are not meant to be punitive, but rather in public health, there is no distinction in disease between a diplomat and a non-diplomat. I want to thank them for their resilience. I want to thank them for their understanding, and we'll continue to work with them to ensure that we return back to as much as possible to the normal circumstances. We'll continue to review the restrictions that have been placed on various countries. In our last briefing, the chairman announced that India was removed. The remaining countries are also under consideration, and we'll continue to review them as soon as the condition is appropriate. These countries will also be removed from the list of restricted countries. We'll also continue to review the global risk that other countries pose to Nigeria, particularly taking into consideration that our unmitigated state of very low vaccination, where we know we're at an increased risk of getting new infections as well as getting the infection to circulate and to be transmitted from one person to another. I continue to assure Nigerians that we will open up public places as soon as the condition is also right, based on the risk that we have and based on the level of vaccination in the country. I want to thank you, and I want to enjoin the public to continue to comply to our non-pharmaceutical intervention, and also urge the state governments, the 6 high-priority states, that we have sent these teams to go and support them in developing the framework to give them the maximum cooperation, to ensure that when we begin implementation of restrictions or of enforcement measures, that the public is aware, the public is sensitized, and that we will achieve our desired goal. Thank you very much.
We thank you very sincerely, Dr. Mukhtar, the head of Technical Secretariat, for that very detailed explanation of activities. Well, I have the permission of the chairman of the Presidential Steering Committee that today, as a mark of respect for one of our dear friends who has been on the side of the media, he's worked with us, and he has now moved higher to a more responsible position to represent Nigeria in a world body. To this end, I am directed to please request one of us from the media to now say some few words on Dr. Chikwe, the outgoing DG, NCDC. May I now please invite our representative, Ms. Amaka Ude of Arise TV, to represent us. Amaka.
Well, good evening, Mr. Chairman, members of the PSC. Well, I did have this entire speech planned, but due to time constraints and, of course, everyone is tired. Yeah, I had a full speech plan. But Dr. Chikwe, on behalf of myself and, of course, the entire press corps of the Presidential Task Force and now Presidential Steering Committee, we just want to say thank you. Thank you for all the hard work that you have put in, not just in the response against COVID-19, but at the NCDC and fighting infectious diseases. I promise you, Nigerians do not take all of your efforts for granted at all. And as you go up to a bigger responsibility, we do know that you go out there and represent not just yourself and your family and your constituents, you represent Nigeria very well, and we are so proud of you. Congratulations, Dr. Chikwe.
Thanks so much. We'll now rise to take some pictures with Dr. Chikwe. We start with the members of the president.
No questions from them?
No question today. We'll now take pictures. Pictures first with the members of Presidential Steering Committee. Please, you may rise to have pictures with them.
Where?
Here.
Okay.
This vaccine is safe, and it has been certified safe and usable by NAFTA.